All right, welcome back to Earnest Medicine. We've recorded 2 podcasts today.
Yes.
I don't know that the audience needs to know that, but we're just turning them out. We're doing a high volume, and it's excellent because it's exciting to have people in, especially. This is our second in-studio guest, and I just have to say that that's always a pleasure because it's one thing to have a virtual guest, but to have somebody come in and we get to interact with them, it's much more visceral. And from a viewership perspective, we get to use cameras and mics here, which is phenomenal.
Yes.
But we have an awesome guest today and a perfect segue, I might add, to Dr. Brown's international travel that's coming up in Istanbul in Turkey. We're honored to have Nora Tolun in our studio today. She is an embryologist, a medical laboratory scientist, a consultant, an adjunct faculty, and co-founder of Astramedica Travel Agency. Thanks for tuning in to Earnest Medicine. All right, welcome back to Earnest Medicine. I'm going to turn it over to Nora for her introduction. We're very excited to get this conversation rolling. Here she is. Nora, how's it going?
Hi, I'm good, thank you.
Excellent.
This is Nora Tolun. I'm very pleased to be here today.
Awesome.
I'm really usually not very good with public speaking and things like that, but you guys made me really feel comfortable, so I appreciate it. So I'm feeling great.
Absolutely.
Happy to be here.
Absolutely. I wanted to briefly ask your connection to Dr. Brown. Dr. Brown knows a lot of people in Washington, D.C., and I'm always very fascinated to learn about how you meet people, how you interact. What was the connection for the two of you? I'd like to dive in just a little bit more on that first.
We have a mutual friend.
Through a mutual friend.
Yeah, and so I'm half Turkish, and so obviously one of the attributes of Washington, D.C. is there are some very fine Turkish restaurants, and one in particular stands above, which is Agora. This is an establishment that's on 17th Street in DuPont area, and Ishmael and the rest of the crew there are like family. And Murtab is a mutual friend, and I was on the conversation with her just last week, and she was like, oh, wait a minute, I have to get you. She found I was going to Istanbul to revisit my roots and discover more about developing episodes of Earnest Medicine there. And she said, wait a minute. And so because I had asked others, and this is, not to dig anybody, but there were a lot who were saying a lot of things. Murtab was the only one who actually committed to actually giving me a contact, and she gave me an excellent one in being able to be introduced to you.
Yes,
So,
thank you.
Yeah,
It's such a great pleasure to be here
absolutely.
and to know you guys personally.
So the Turkish connection, where in Turkey are you originally from?
I'm from Izmir.
Izmir, okay,
Yes.
all right.
Yeah.
So in comparison, population-wise, compared to places like Istanbul, Ankara being the capital, of course, but then Izmir would be, in comparison to size, is like the
Third biggest, yeah.
third biggest, okay. And what would you say is the major industry in Izmir?
Farming, cotton, tobacco, things like that. It's very big, and there are like a lot of like factories too.
Yeah,
like
textiles,
textile
and furniture.
factories. Yes,
yeah.
yes.
That's what Turks are very well known for as craftsmen. For sure. Now, what's interesting is, my mom was born and raised in Istanbul, and she came to the United States as a Fulbright scholar to teach. And one of the things about education in Turkey, which is similar to others, is that in your future life, as you develop a profession, it is based on examination. And then based on the examination, you place a certain place, and it kind of decides what your future will be. You were in the sciences, correct, back home. So that requires a certain station of education, and you have to exam at a very high level. Tell us what it was like growing up in Turkey, and then also what the experience was like, education there.
Education system there is, oh my God, it's usually very stressful.
Yes.
Education is good in terms of the things you learn and they teach you, because you have to go through, pass this entrance exam to go to college, basically. and it is very competitive. Like millions of students take the same exam on the same day, same time. It's very stressful, and so for that, the education you receive is like very challenging. However, now that I'm just comparing it to here, I'm in academia. And actually today I just had a student with ADHD. And we gave her an extra hour for that disability.
Yes.
I'm just giving an example. I wish we had that opportunity in Turkey too, because not every student is the same.
Yeah.
Some people, they have like disabilities, some people, some are autistic. Like, it's all like, I don't think it is a fair way to, yeah. But yeah, I believe I received good education nevertheless.
Yeah, I mean, everything's different, you know, and I think,
very different.
but obviously you came with a lot of student debt too, right?
Yes.
No, I mean, Turkey, the education is free.
It is free. I mean, it depends on, so there are now private colleges too.
Okay, all right.
So,
but you understand here that the medical, you know, any of the education, you know, you have some students who could be $250,000 in debt.
Oh, yeah.
And you don't, I mean, so what is the pressure of an exam versus the pressure of debt? I'd much rather take the pressure of an exam than feeling indebted the rest of my life. But then, growing up back there, and then where did the inkling come for coming to the United States?
I was originally planning to go back to Europe. I stayed in the Netherlands for about a year. My original plan was to go back there for my master's, and then I changed my plans, and then I decided to move to here instead of Europe. So.
Okay. Excellent.
Was there something that motivated that initially? I know that when it comes to lifestyle in Europe and the United States, there are some similarities, but obviously some differences. What was the motivating factor to come here versus there?
I fell in love.
Really?
Yeah, that was the only motivation really.
So more maybe environmental, or what was available.
Yes.
Okay. Understood. Very nice. And I wanted to hit on one point. In your description, you talk about adjunct faculty. Where is it that you're filling that role? I'd like to learn more about the educational or academia portion of that.
Oh, that's at George Washington University here in D.C.
Very nice. What kind of roles are you fulfilling in that position? And also, what has it been like to work with some of the students and other faculty in that area?
It's been great. I believe I started there as like a student in 2010, and then I eventually started working at the hospital, and same institution, and then eventually I moved on to the academia part and to the education part. So I still work there as a staff. I worked there as an adjunct, so I worked at like different roles. And it's like family to me now, it's great, and to be more specific, as an adjunct, I'm now trying to develop the courses for their art program. And by art, I don't mean the Monet art.
Yes.
Assisted reproductive technologies program that is
exactly
new.
And, so tell us a little bit more about that. And you focused into a certain area of your expertise, which is fascinating. Fascinating in one sense in terms of what that is here in the United States, but then also what it could be back like in Turkey as well. So tell us a little bit more about that.
I mean, art training is, I feel like, much more advanced in Turkey and overall in Europe compared to here. When I moved here, I was like hectically trying to find a job to work as an embryologist.
Yes.
But there is no such category, like no education. And then I figured I would have to be a medical lab scientist
to be able to
work
Yeah.
in an embryology lab, which is so different than Europe. Because there you have to finish a master's degree in embryology with a thesis, and now you have to work like at least 6 months, I believe, at a hospital, and then you get your certification to work as an embryologist. Here, it is completely different.
Yeah.
So
so when we talk about it, for viewers who may not, we're talking about specifically embryology, but also fertility, where it's helping in patients, families to have children, and in that regard, there are certain in the clinical field, there are certain techniques that are used in preparation for starting a family. This would be for couples who aren't able to conceive, and they've come to a facility that would then support them to be able to try and achieve that. So working in that capacity, you've seen already the difference between Europe and Turkey and the United States. And, it's interesting because, what do you think are the factors that now that you've been here for some time, what do you think are the factors for why there is that difference?
Honestly, I'm not sure why it's so different, but I know that it is different. And when I talked to the university, with the upper level leadership, I explained that to them that there is a need for this. We need some sort of like higher education in clinical embryology, not just what the doctors take.
Yes.
But people who can work in a lab and do the actual procedures.
Yeah.
Which is very important.
Extremely important.
And they were like, let's move forward with the program, and they approved it.
Fantastic. That's great. So you are affecting a change in
now we had like first set of students, and I'm now working on preparing the clinical embryology courses for them, which I believe they're going to start in summer.
That's great.
Yeah.
In Europe and Turkey, if there is a patient who has infertility issues, then that is paid for by the government. Is that correct?
I believe they have some benefits. I have to. Yeah.
Versus here in the United States, it is almost considered that pregnancy is elective, and that the payment tends to be, unless there's another medical condition contributing to, you'll have patients who have a significant outlay of expense to be able to conceive, and with no guarantee. I mean, no
guarantee, and the insurance companies are not, unfortunately, covering it.
Yeah, they don't.
Most of them.
As much as people pay and those sorts of things, but when infertility is a major social factor for a family, can lead to strife within the family and concerns. I've had to go with several clients actually to their appointments, infertility appointments, and I got to see firsthand kind of the interactions. And I must say, on my end, seeing it as a clinician, I only saw kind of like factory work. I didn't see that connection to the patient. And it was like, oh, well, this is the way. And I directly had patients who came from other countries and said, we don't do that there. And why are you doing this here? And they were very apprehensive and in some regards disappointed about how it was done here in the United States. What do you see in your practice now? What do you see moving this forward? I don't think insurance will ever take it, right? So then it's up to patients to make decisions about things.
The factors are, is so many factors affecting the social factors, economic factors, political factors. So I don't know if insurance companies will eventually start.
No, guaranteed they won't. But
yeah,
but people should have options, and one of those options is to consider that, well, if it doesn't work here, could it work someplace else?
Oh yeah.
And so, tell me a little bit more about what in your expertise as an embryologist, but also what your experience has been with clients who are seeking to get pregnant and aren't able to, and don't have the resources to be able to fund continuously. You had a story about a family like this.
So I own a medical tourism company, and we get quite a few requests from patients who can't get pregnant, so infertility patients. So that's very, on demand because the infertility rates are increasing. So one option is sending them to a clinic where costs are cheaper and quality is, high.
Yeah.
So that's one option that, I could think of.
So medical tourism is this concept that, many here in the U.S. who may be viewing this are not very familiar, but being half Turkish, you being full, there's a certain sense of this story that we will capture when we go to Turkey. And that is that there are a body of very skilled clinicians, technicians that provide services, if you were to compare them here into the U.S., are equal to, if not superior, and at an astonishingly cheap rate. And I will relate this story that I have known for years when going to Agora and coming in and having coffee and talking to them, they'd all be like, oh, I'm going back and I'm going to have all my teeth done and I'll come back. And I was like, it never really sunk into me. And then I had a client recently who I actually took to get work done on his teeth, and the bill was $50,000. And
I'm not surprised.
I took that invoice and sent it to a colleague in Turkey, and they could buy the flight, they could stay at the beach for 2 weeks, get all the dental work done, and it would maybe be $3,000 or $4,000. And why? I mean, it was just astonishing. So the story of, that medical tourism, which is, they do dental, they do hair implants, which I have no interest in whatsoever. But there are other things. They're even talking about cancer treatment.
Oh, yeah.
And they're talking about infertility and those things. And I think those are things that, I think people should have choices. They should not be bound by what the status quo is, especially when the status quo is ineffective and highly expensive. I have, friends now who trying to conceive, and unfortunately, the expense. So now I'm just like, well, why don't you go on a vacation?
Exactly.
And, Turkey is a beautiful place, and we will show it when we go, And I understand that, you're here and setting up your medical tourism, and I applaud you for that, because you are taking something and you are applying it that will be good for people, I mean, the stories will prove themselves, right? And enriching people's lives, And I think it's important for people to understand that, there is to be independent, to be not just accepting what things are, but to move in a direction that's positive for yourself, for your family, for your community is extremely important. So I will be going to Istanbul tomorrow, and it's part of it is capturing some of those stories and actually meeting one of your colleagues in Istanbul to talk about more of this.
Yeah, my business partner.
Exactly. Yeah. And part of it will be learning about the history, the education, all these different facets. So we would appreciate being able to connect with your team and explore whatever this might be. We will need guides. I might need some dental work. I don't know. No hair implants, please. And I don't think infertility, but you never know. That being the case,
they may be tempted to do that. So just
I mean that would be hilarious. Actually, to come back with a full Fabio,
full head of hair.
Yeah.
That would be.
You should wear one of your wigs while you're over there. I wanted to follow up with a question, and this is maybe more of a question about American society and culture in general. You talked about in the early phase of your career as an embryologist, finding it a little bit difficult to find those resources for women. And it's a very well documented situation in the United States where things like maternity leave, or you get 2.5 months, 3 months. It's staggeringly low when you compare it to other places in Europe and around the world. Is there a little bit of a trend there when you look at women's reproductive rights, women resources? Have you noticed that? Is there any connection between the two of those things in your own estimation?
By connections, like you mean compared to Turkey, or
I think, yeah, compared to Turkey, but also compared, like you said, you were looking at maybe going to Europe and settling down over there. Was there any of that that you sort of calculated in the decision?
not really.
Okay.
I
Fair
wouldn't
enough.
be coming here if I did.
Yeah, we'd never have met, honestly. Yeah, if there wasn't a reason to. Yeah.
Yeah,
that makes
yeah.
sense.
I mean, yeah.
So part of it is a lot of Europeans will go to Turkey, and they are essentially tourists, but they're going there as tourists for medical procedures or health and wellness. There are a number of resort spas that are affiliated, solely for that purpose, and it's a whole industry. But there's no concept of that here in the U.S. other than something like a canyon ranch where somebody would go to. But in Turkey, it's very common. And it's just here in the U.S., we never hear that Turkey has that and has actually refined that to be really the best in the world, in my opinion. From your perspective, what do you think would help anyone to at least explore? There's the language barrier. There's the cultural barrier. But what are some other things that you think might help people to kind of consider it?
I mean, here in America, it's a completely different target market here, I think, compared to Europeans. Europeans, they like traveling. I've never met a person who lives in Europe who doesn't travel. They all have
True.
passports and they travel.
Yeah.
Here, I've seen many Americans who never left the country.
Yeah. Yeah.
No passport, never left the country and not interested in going anywhere else. So I'm like, it kind of amazes me, like, why?
Yeah. Should be mandatory that you leave. No, yeah.
Yeah, to me, it's crazy.
No, I think you're actually right. I think you hit it right on the nail that, America is very isolated. I mean, in Europe, you couldn't be in one country and drive through 4 different countries in a matter of hours, or take a train and even more than that, and different languages, different histories, those sorts of things. I do think that isolation here in the U.S. is a barrier. And, but I think what breaks through that barrier is that you have services in Turkey through tourism that focuses on health and wellness, which is far cheaper and much more effective than, kind of the factory work that's here in the U.S. I can't identify anything in the U.S. that even comes close to what you would find in Turkey. But that barrier for Americans to get up and go, it's that sense of curiosity.
Right.
That's why do you travel? What makes somebody want to pick up, throw everything they have into a luggage and then travel halfway around the world? There's got to be some fundamental thing. If they're traveling, because they're curious or they have something that they want to explore, then that's why they travel. And I think if one wants to explore one's own health and wellness, that's certainly a consideration.
Well, in my experience, I'm seeing 2 different types of medical travelers. One is people who want to travel just to get that treatment or surgery, whatever they need. So for medical purposes, their main reason is to travel there to get healthcare. And it's very purpose-driven kind of travel. The other one is they just want to travel like a tourist, just go, see the country, maybe take a vacation. And while there, they just want to get something done, like at a cheaper price usually, or so that kind of patient. So I see too. So I'm thinking maybe for the United States, for Americans, the option 2 might be more.
I think so. I mean, the idea of sitting on a beach and then, for 2 weeks and paying less, the issue is travel there. The flight is, from Washington, D.C., there's a direct flight to Istanbul. It takes 10 hours. So that's relatively easy. Other parts of the U.S. would be, harder, of course. But, with a direct flight from here, which is what I'm very thankful for.
Right, yeah.
Getting there and then getting down the coast where a large number of these facilities are. Yeah, I'm excited to explore this with you as a guide for us, to open up the layers that maybe will open people's minds with the opportunities. And again, I focus in on it as a sense of empowerment to make choices for yourself, not to be set with what the status quo or, you know, whether it's infertility or, you know, obesity or, you know, general health and wellness, teeth, hair, all of those things. And I think when the Turkish people have built this, people come. It's already obvious. It's just we just don't know that, and it's so foreign to us here. We're locked in. We're kind of like cattle, you know, for the insurance companies and the pharmaceuticals. We can't escape. You know, we're all in that cage. You know?
Right. I mean, yeah, healthcare there is in Turkey it's the hospitals. You can go to JCI accredited hospitals. It's like 5-star hotels.
Yes. That's another thing. Yes.
And like, I don't think like many people don't know this, not aware of this. So it is like a really, why pay, before paying that $10,000 bill to get like a dental treatment, think twice before you pay that. You work hard on that money. So think twice and explore your options.
Yeah. Explore the options. And, you know, if you have to get your appendix removed, just get an emergency flight and land in Istanbul. As soon as you're in the ER here in the U.S., you get the diagnosis, you book your flight. You should do that as a business. You should say you have these emergency transport planes. That
maybe not emergency situations.
No, I know. But I'm just joking. But, you know, it is fascinating to see, and it will be even more so because we will be looking at the education, the history, all of these features. And certainly this is an important one because it's, you know, it talks about the modern solution to things.
I wanted to follow up briefly with a question with the new abortion ban. You know, we talked briefly during our break about people who are now doing interstate travel in order to get the medical needs they need taken care of. And some of their employers are sponsoring those kind of trips. I don't think the United States or a major United States-based employer would ever say, hey, go to another country and spend all your money there. But do you think that kind of shift politically is motivating people to open their eyes a little bit about like, hey, I might not be able to get what I need here at home. I got to work a little harder to go somewhere else. I don't see that as a positive thing, but to shift the mindset of these people, maybe that's a little bit of a push in the right direction. What do you think there?
Exactly. Medical travel is not just an optional thing. It may sometimes be mandatory.
Yeah.
You know, a few months ago, Supreme Court overturned the abortion rights, and now some states banned abortion, and those patients have to now travel to another state to get an abortion. So sometimes it is just not available, so you have to travel.
Right.
But sometimes it is not timely that you have to travel. Like since the pandemic, we see huge wait lines for some surgeries in hospitals in the United States as well as in Canada, in England. Like a lot of developed countries are struggling.
Yeah, the healthcare system is overburdened. I've heard them say that over and over again. But at the same time, you know, I have to say that sometimes what they say is because they've designed the system to fail, you know. So, you know, I think it's in the hands of the people. If we give people choices, they will make decisions. And those decisions are the decisions that they need to make, not somebody else making it for them. So.
Well, you talk also about a shift in the medical model, right? The United States experienced a pretty drastic shift whenever we started to move toward a more insurance-based healthcare system. Is there any fear of something like that starting to take over in Turkey? Obviously, when we're talking about it, it sounds like paradise compared to what goes on here. But as you look at shifts in educational models and the way that things are run, is there ever that concern that maybe there's a movement more toward these insurance-based style of care, which is not working out so well here?
Oh, yeah, definitely.
I mean, I always call the insurance companies the mafia, you know. And, you know, no. They are. And, you know, the mafia, when they find a good gig, you know, coming to your country.
I think that's the major reason why our healthcare is not getting to the top.
Yeah.
It is always pulling it down.
Yeah. I mean, I keep saying it, and then everybody probably, get tired of me saying it. But, when 20% of our GDP is healthcare and you go to Turkey and it's 5%, you realize there's 15% of profit, which is insane. It's off the blood, sweat, and tears of people.
But you can go to ER and bleeding, and they would still be asking for your insurance
and
information and your copays and everything. I was like, bleeding here.
Yeah. No, that's...
Speaking of that, I said this earlier, but when Carlos had a scooter accident, literally bleeding, like we're sitting there in the ER, and we were there for 9 hours. 9 hours. And eventually, things got taken care of, but the whole day was gone. Yep. By the time he was able to go back, see a specialist, and get 7 stitches or something, it was pretty minimal. It took all of 15 minutes. How many stitches did you get?
Like 7.
Okay.
All I wanted to do was get back to work.
Yeah, I know.
Exactly. So, I mean, that's a real thing for people here. Literally, bleeding in the waiting room.
Oh, yeah.
That's not a good thing.
No.
So we would certainly relish the opportunity to take this. I will be going preliminarily to Istanbul to, trace my roots and talk about the history and walk around the streets and philosophize. But, at the same time, having somebody like you and your partner as guides to give us insights and connections to be able to tell those stories. And that's the thing I want to really stress is that we're just capturing the stories. By doing so, it gives opportunity for everyone to participate, to tell their story when their story may never be heard. And I think that's a shame. I think people have a lot. And I think the more we have our stories heard collectively, the more things can change in a positive direction. It's when the conversations are stopped, then people take control of that. And, for myself, that's not acceptable,
Yeah.
So.
And I totally understand that for someone who never traveled or who never even heard of Turkey, it can be like quite stressful to go there. Not only go there, not just a tourist, but to get medical treatment. So I know it can be quite like stressful. But with the help of professional medical agencies, they arrange everything, pick you up from airport, handle all the transportation, take you to the hospital, schedule your consultations, even post-op visits, and they basically take care of everything. So, which kind of reduces.
Which you won't have anybody do here.
Yeah.
Besides this guy.
Well, yeah, besides me. You don't have that concierge experience here. You'll have people say they're a concierge physician, but there's no concierge. I am, but what you're providing is that extra layer. Like imagine if you walked into a hotel, there's no concierge. Well, you're just staying there, right? It's not an experience. Whereas when you have a concierge involved, it's the experience of that. Which is more important. Exactly. So, in a sense, you are a concierge medical travel. Yeah.
Yes.
Well, I just have to say we're very excited to have you here because the whole premise of this is to show people that there are different ways of staying healthy and fixing issues with regard to health. And this is one that's a very valid solution for a lot of individuals' problems. And the hope is that while you're there and meeting up with your individuals who you have connections with there, that you can kind of show people like, hey, this is not bad. This is something that you can do for yourself. And there are programs and steps set up along the way to make it very realistic and very achievable for you. And just getting that in front of people, I think, is really valuable because if they can understand that the barrier is not that high, you can do it too. So that's quite special. So I'm going to kick back over here to this cam and just say that we're going to wrap this episode up, but I wanted to give Nora an opportunity to share some links or share some website information. So if anybody needs a little extra help up front on the hairline or IVF, anything medically tourism related, this is a great resource, especially if you're here in the Northern Virginia, DC, Maryland area. this is a real service that's helping real people, and that could be you or your family member. So I want to kick it back over to Nora. How can people find you? Where do they search for your business, and how do they get in touch with you?
Well, our website is Astramedica.com, and we're also on social media, Instagram, Astramedica. If they search, they can find us, and we'll be happy to help them.
Absolutely.
Yeah.
And for somebody who's doing this for the first time, what's the process like? Is it a phone call or a form submission on the website? How do
Either
you,
way,
yeah.
typically either a phone call or a form submission is fine too. Then we'll reach out to them. We offer free consultation, and first find out what the patient needs, what kind of procedure they need. Turkey is a mecca for plastic surgeries. They do an amazing job. Very highly trained, highly qualified doctors doing their surgeries at JCI accredited hospitals. They're even like, American hospitals too, if they, if the patient is really, they want to go to an American hospital, we have that too. But hair transplants, very big, plastic surgery, infertility treatments. So those are like very big, or checkups, they are very big in Turkey.
Yeah.
So we would be happy to help them arrange their trip from A to Z.
And health and wellness resorts?
Wellness is getting also very big,
Yeah,
yes.
yeah.
Yes,
Yeah.
wellness is, especially after the pandemic, now it is a very big tourism, medical tourism area, yeah.
Yeah, we'd love to, visit one of those. In particular, something that, it's hard to go into a hair replacement place without somebody trying to sell me something, but my own hair, I suppose. But I would be very interested in, programs where, you're able to focus in, Canyon Ranch actually did try to establish in Turkey. That failed in large part because I think they didn't quite get the Turkish culture. So weaving that in with, what is there now, it'd be fascinating to explore it. So those connections that you might have, and setting that up, and then we get out there, and that would be a great experience. And open it up. The intention for this is to open it up for everybody to really explore it.
Well, we just want to say thank you so much for taking the time to come visit us. We're always very appreciative of having people come to the studio and sit down and speak to us about what they do. And it's been wonderful to have you in for this session.
Thank you. It was very wonderful to be here, and it's been a great pleasure meeting with you.
Thanks so much.
Thank you
so much. All right. Thank you again for tuning in to this episode of Earnest Medicine with Nora Tolun. We're very excited to have her in because this is really kicking it off for Dr. Brown's international excursion. So we hope to be able to follow up with you soon with some great footage and stories of his international travel. So until next time, thanks for watching Earnest Medicine. We'll see you.
And if you happen to find any of this interesting, or more importantly, if you want to collaborate, check out the link below so that you can send us your comments, any stories you may have, anything. We're happy to entertain it. And this is really about us going on a journey together.